you've got a patient who's presented to you with all the kind of potential symptoms that we've discussed up until now, and then you're in a position where you have to start to take decisions. And I think, as we said earlier, this is an urgent issue, but the patient's not bleeding out on your table, so you don't have to rush, put them into your car, drive them off to A&E. Take time to consider your decision. Think about what information you've gleaned, what you've found out about the patient and the condition, and what kind of sense it all makes to you. Just step back, think about it all, and organise your thoughts so that you can be clear about where you're going with all of this. If you are able to, it sometimes helps to talk to a colleague. Certainly there's nothing wrong with if you have a colleague in your practice, with discussing it with a colleague and saying, this is what's going on. Do you think I'm on the right lines here? Yeah. Do you think this would be appropriate? If you don't have a colleague, call the on-call fellow at the hospital. They're never going to hang the phone up and tell you you're being ridiculous. If you've got a reasonably put together, constructed argument where you've worked through the process and you say to them, these are my concerns.
I wonder how many people watching would have ever heard before that this was an option to ask to speak to the spinal fellow. It wouldn't have occurred to me. I didn't even know such a thing existed in hospitals. Yeah. I thought you were the spinal fellow when you went
well, I was. But there are orthopaedic fellows, surgical fellows, neurosurgical fellows and spinal surgical fellows. And that's what their job is. And they carry a bleep for their shift. And they won't be doing surgery, they won't be doing injections, they won't be doing clinics. They are literally sitting in a room waiting for a phone call. Right. So actually you're doing...
Are they kept busy?
They're often involved in bits of research, so they'll be writing papers.
Okay, but they're not answering phone call after phone call after phone call, so they're likely to respond.
They've got a bleep, and there's an expectation that when you carry the bleep, you respond in a timely way. So, once they get the message, but you call the switchboard of the hospital, they'll bleep the fellow straight away. As soon as they get to a phone, they'll call you. They might be a little bit kind of dismissive of you. What are you calling me for? But stand your ground, be confident, articulate your case, and I'll be very surprised if a fellow tells you that you've wasted their time.
Yeah, okay.
Focus on the decision and not the outcome, because sometimes you sit there and you can feel your heart racing and the beads of sweat forming on your forehead. And it's because you're thinking, what happens if this patient gets to the hospital and the surgeon comes along and says, what a ridiculous referral. Don't even think about that. Don't think about the outcome of the patient having surgery, not having surgery, being sent home. That's not what matters at the time. What matters is the decision that you're going to take in front of you. And that's the bit that you need to focus on.
Yeah, and to re-emphasise that once again, I will talk about that consultant we had on the show who said he would rather get out of bed in the middle of the night and see people who didn't have Cauda Equina than miss one who did have it.
Absolutely, that's absolutely right. And then the last bit is accept that there's a degree of uncertainty about this for all of us involved in it. And when I worked in the hospital, we would sometimes call the on-call fellow into a clinic and say, we think there may be a Cauda Equina issue developing here. And the surgeon would do all of their investigations and examinations and look at MRI scans, and they'd sit there for a little while going, this is a tough one. I just need to have a little bit of think about this and decide what I'm going to do. And these are people who deal with it all the time. Yeah. So, for those of us who come across these things in the community very rarely, it's not a straightforward decision, and there is going to be a degree of uncertainty, but rather err on the side of caution than not.